Today I am going to tell you certain important things about newborn jaundice. Jaundice actually means yellowish discoloration of the skin, usually seen in newborn babies on day 2, day 3. Generally, the main common reason for newborn jaundice is they actually have very high hemoglobin when compared to adults. So, in the process of bringing down that hemoglobin to normal adult values, some of the RBCs will break and they generally convert it into something called bilirubin. And that's the reason why most of the newborn babies in fact have jaundice. It's very common both in term as well as preterm babies. And the other common causes of jaundice in newborns are something called Rh setting, where mother has a negative blood group and the baby has positive blood group, and also ABO incompatibility, where the mother is having O blood group and the baby is having A or B. There are some rare causes of jaundice which are related to the liver and metabolic disorders. But all the more, if you see, most of the babies have physiological jaundice, which even usually disappears in 2 to 3 weeks. It's very important to get jaundice treated whenever the value reaches a certain cutoff, and these cutoffs vary from day to day. If the jaundice becomes very severe, it can actually affect the brain and also the hearing system. So that's why it's very important to get screened for jaundice and get it treated if it is in the treatment range. The usual treatment which we give for jaundice is actually phototherapy. Sometimes when the jaundice is actually very high, we need to do something called exchange transfusion in some cases. Most of the times mothers do ask about their diet and newborn jaundice. Actually, there is no absolute relation between mother's diet and baby's jaundice. So it's important that the mother takes normal diet and continues feeding for her baby. Most of the times jaundice subsides by 2 to 3 weeks. When we really need to worry of jaundice is when the values of jaundice are very high, which is nothing but the bilirubin value. Second thing, the baby is very drowsy, has associated fever. And any baby who has jaundice persisting beyond 2 weeks of life, or if the baby's stool color is pale and the urine is high colored, these babies definitely needs workup for newborn jaundice. Otherwise, most of the times when treated adequately at the right time, jaundice subsides by itself. Thank you.